morning.
Hi, my name is Danielle. I'll be your student nurse today. I'm just going to wash my hands and make sure I have all my equipment. So I'm washing my hands for infection control. I'm taking an alcohol swab and wiping my stethoscope down. I have my gloves, my pen light, my smelling device, and my stethoscopes. We're all ready to go. Can you tell me your name?
Jenna.
And where are you?
Portland.
And what time is it?
12.
And what are you doing here?
An appointment.
Okay. So patient speech is articulate and clear. Patient's level of consciousness is alert. Patient is alert and oriented ×3. Are you in any pain today?
No.
And do you wear any assistive devices?
Contacts and glasses.
Okay, so patient reports a visual correction with contacts and glasses. Patient appears appropriately dressed for the weather. Patient is pleasant and can answer my questions and is cooperative. Patient appears to have good hygiene and is well responsive. So we're going to start the assessment. I'm going to touch you in 3 different places. If you could close your eyes and identify them for me, please.
Forehead, left arm, right leg.
Thank you. So patient is able to, has adequate sensation in her upper and lower extremities as well as her face. Can you touch your nose for me, please? And touch my finger back to your nose and I'll move my finger out. Thank you. So patient shows that she has good coordination, is able to follow commands. Can you touch your fingers to your thumbs, please? Thank you. So patient shows that she has good, adequate fine motor control. Can you puff out your cheeks and smile, frown, and raise your eyebrows? Thank you. So patient has good sensation in her, or has her cranial nerve 7 is intact. Can you take your heel and put it against the base of your shin, please, in the other leg? Thank you. Patient shows that she has adequate gross motor control. If you could stand up and walk towards the wall and back towards me, please. So patient's gait shows that she has adequate gross motor control. Gait is fluid and smooth, no signs of a limp. Was there any pain with that? Okay, patient reports no pain or discomfort upon walking. Her posture is erect, head is erect in midline with the body. Shoulders and hips are aligned. There's no swaying or discomfort. Could you hold your arms out and close your eyes? Thank you. So I just performed the Romberg test. Patient passes the Romberg test showing no swaying. Could you hold on, stand on one foot and the other? Okay. Patient shows adequate balance and coordination. If you could bend down and touch your toes, please. I'm going to palpate your back. Is there any pain with that?
No.
Okay, thank you. So patient shows reports no pain upon palpation of the spine. There is no signs of curvature. Spine is straight in midline with the body. No lumps, masses, or lesions were noted upon palpation. You can sit down. Thank you. So I'm going to tell you 3 words. I'm going to ask you to recall them for me towards the end of the assessment. So they are tree, leaf, and flower. Okay? So I'm going to put gloves on, performing promoting infection control. And upon inspection of the patient, her facial features are symmetrical. Her head is erected midline with the body. The skin of the face, I'm just going to palpate quickly. Okay, so the skin of the face, the eyes, ears, nose, and mouth is pink, warm, and dry, and warm to the touch. There are no tremors or tics detected. Was there any pain with palpation? Okay, patient reports no pain upon palpation. Alright, so I'm just going to palpate your scalp now. Was there any pain with that?
No.
Okay. Patient reports no pain upon palpation. The scalp the skin of the scalp is pink, warm, dry, no excess moisture. The skull has no deformities, no masses or lesions. The hair is evenly distributed, no signs of baldness. The hair is smooth and shiny in texture, is blonde in color, has no signs of infestations or breakdown. Okay. So now I'm going to move on to your ears. So upon inspection of the ears, they are midline and center with the body, or symmetrical. They appear fully formed, and I'm just going to perform a whisper test and whisper 1 word in each ear if you can recall them for me.
Book. Blanket.
Alright, so the patient has adequate hearing and was able to recall both words. We're just going to palpate your ears now. Was there any pain with that? Okay, patient reports no pain upon palpation of the ears. No masses, lesions, or lumps were noted. There's no swelling or edema. Upon inspection of the external ear canal, there appears to be no drainage. So I'm moving on to the eyes now. So eyes are symmetrical with the body. The eyes are almond-shaped and bilaterally equal. They are symmetrical and proportionate to the head. The irises and pupils are both round and color distribution is equal. The skin color of the eyes, ears, nose, and mouth is also proportionate and equally distributed throughout the body. The sclera is white, smooth, and clear with no signs of drainage or discoloration. The conjunctiva is clear bilaterally, no signs of drainage. The eyelids have no signs of edema, drooping, or swelling. Hair from the eyelashes and eyebrows have no signs of baldness. No hair is adequately distributed. I'm just going to see the size of your pupils. So they're about 5 millimeters in diameter, and I'm just going to look at your corneas. So corneas are transparent bilaterally, right? And I'm going to see how your pupils react to light. Okay, pupils were able to constrict consensually, and I'm just going to have you follow my pen light with your eyes. Okay. Patient is able to pass all 6 cardinal fields of gaze, no signs of nystagmus or swaying. Patient was also able to accommodate, so patient is Perla, showing that her pupils are reactive to light and can accommodate. I'm just going to do a peripheral field test. If you could tell me where you see my hands.
Yeah.
All right, so patient's peripheral vision is intact. Okay, I'm moving on to your nose now. So nose is center and midline with the body and symmetrical. Have you had any pain with your nose or your eyes? Okay. Any drainage with your nose?
No.
Okay. So patient reports no pain and no drainage of the nose. Can you hold one nostril and breathe in the other? Okay. Patient's nares are patent bilaterally. I'm just going to look up. No occlusions or deviations were detected in the nares. And I'm just going to grab an object. If you could close your eyes, I'm going to have you smell an object.
Soap.
Thank you. So patient was able to adequately identify the smell, showing that her smelling is intact. I'm going to move on to the mouth now. So upon inspection, the lips are pink and moist. No signs of skin breakdown or cracking, inflammation, or lesions. Could you open your mouth and say ah, please? Thank you. So uvula is midline with the body, goes up upon saying ah. The tonsils are present, showing no signs of infection or inflammation. The back of the throat shows no spots or infection. The oral mucosa shows no signs of cyanosis and is pink and moist. The tongue is symmetrical and bilateral, is pink and moist in the center of the mouth. Teeth appear to have good dentition. There are no foul odors coming from the mouth. The gums appear to be pink and moist and are not bleeding. Do you have any pain in your mouth?
No.
Okay. So I'm just going to move on and palpate your frontal and maxillary sinuses. If you could tell me if there's any pain.
No.
All right. Patient reports no pain upon palpation of the sinuses. Sinuses were non-tender, no signs of lesions or masses, and no hardness was detected, showing no signs of inflammation or infection. I'm going to palpate your lymph nodes, so your preauricular, your postauricular, your submandibular, and your cervical. Was there any pain? All right. Patient reports no pain upon palpation of the lymph nodes. Lymph nodes were non-palpable. No masses or hardness or lesions were detected, showing no signs of infection or inflammation. I'm going to test your jawbone, so if you could open and close your mouth. Thank you. Any pain? All right. Patient reports no pain upon movement of the temporal mandibular joint. No crepitus or TMJ was detected, and patient has full range of motion in her jaw. Okay. Could you recall those 3 words for me, please?
Tree, leaf, and flower.
Okay. So patient was able to recall the 3 words that I asked her, showing that her short-term memory is intact. I'm going to move down to the throat. So upon inspection of the neck and the throat, the color is pink. The neck muscles are symmetrical, no signs of jugular vein distension. I'm just going to palpate the trachea and the thyroid, and could you swallow for me? Thank you. So is there any pain with that? Okay, so patient has no pain upon swallowing. The skin is warm, pink and dry, no signs of excess moisture. The trachea is midline with the body. The thyroid was non-palpable, and swallowing is intact. So I'm going to palpate your carotid. So carotid arteries upon palpation were bilaterally strong 2+. I'm going to listen to them. Okay, upon auscultation of the carotid arteries, no bruit or whooshing was heard. Rate is regular and rhythm is regular and normal or adequate. Okay, I'm going to perform range of motion in your neck. Could you touch your chin to your chest and all the way back into your shoulders? Any pain with that?
Nope.
Okay, so patient reports no pain and has full range of motion in her neck. Okay, so I'm going to move down to the precordium area. Upon inspection, there appears to be no rashes, discolorations, lesions in the chest area. I'm just going to palpate. Any pain in the chest?
No.
Okay, patient reports no pain. The lymph nodes are non-palpable. There are no masses, lesions, skin deterioration, or inflammation detected. Okay, there's also no heaves, lifts, or thrills felt upon palpation. So I'm just going to listen to your heart sounds now. I'm going to start at the second intercostal space on the right, at the apical. The second intercostal space on the left, the pulmonic. The third intercostal space, Erb's point. The tricuspid. In the fifth intercostal space on the left, the mitral. And now I'm just going to flip into my bell and go back over the mitral and the tricuspid. Okay, so upon auscultation of the heart sounds, no bruits or whooshing was heard. S1 and S2 are present, and there were no murmurs or abnormal heart sounds. Okay, so I'm just going to move on to the respiratory part of the assessment. So upon inspection, patient appears to be breathing with ease, is not using any accessory muscles. The chest is cone-shaped and the patient's breath is quiet. Do you have any problems or issues with breathing?
No.
Patient reports no problems or discomfort breathing. Do you have any cough or sputum?
No.
Okay, patient reports no cough or no sputum. Alright, I'm just going to listen to your breath sounds now. Please take a deep breath when you feel my scope. Okay, so on the anterior portion of listening to the breath sounds, there are no adventitious breath sounds heard, no wheezes, rhonchi, or wails were detected. And I'm going to lift up your shirt now, if that's okay.
Mm-hmm.
So upon inspection of the back, the skin color is evenly distributed and proportionate to the rest of the body. I'm going to palpate. There are no lesions, masses, or nodules felt. Do you have any back pain?
No.
Okay, patient reports no pain in the back. So skin color is adequate and there is no abnormal nodules felt. And I'm going to test the, or listen to the posterior breath sounds. Okay, so upon auscultation, vesicular and bronchovesicular sounds are present. No adventitious breath sounds are heard, no wheezes, rhonchi, or wails. Okay, I'm going to test your lung expansion. If you could take a deep breath. Okay, so lung expansion is equal bilaterally, as evidenced by my fingers moving apart by 1 inch. Okay, and no problems with breathing. Okay, so patient reports no problems with breathing. I'm going to move on to the strength and range of motion. So could you pull up with your shoulders, please? Okay, could you go against my hand and this way? Okay, so patient has 5 out of 5 strength in her shoulder joints and as well as her neck. Could you move your hands in circular motions? Any pain with that?
No.
Okay. So patient reports no pain in the shoulder joints, no crepitus detected, and patient has a full range of motion. If I could see your arm and move your elbow, your wrist, and spread your fingers, thank you, and this arm as well, your elbow, your wrist, and your fingers, thank you. So patient has a full range of motion in the full upper extremity area. Any pain?
No.
Okay, and patient has no pain with the range of motion. So looking at the hands, well, the skin color on both arms is pink, warm, dry, with no excess moisture. Color is adequately distributed, and no signs of inflammation. capillary refill in both hands is less than 3 seconds. Testing for skin turgor, there seems to be no signs of tenting. There's a brisk recoil showing adequate signs of hydration. Could you put your fingers like this for me, please? Okay, so fingers have a nail angle of less than 160 degrees, and nails are diamond shaped, showing no signs of clubbing. There's no signs of cyanosis. I'm just going to assess the radial pulses. So radial pulses are bilaterally strong, equal 2+. Nails are smooth and non-tender. Capillary refill is less than 3 seconds. Skin turgor is adequate, and no signs of cyanosis or clubbing. Okay, can you put your arms out and push up on my arms and down and squeeze my hands? Thank you. So the patient has 5 out of 5 strength in her upper extremities and full range of motion. Okay, I'm going to have you lie down now. You can keep your legs up, and I'm just going to pull your shirt up. So do you have any nausea or vomiting with your abdomen?
No.
Any pain in your abdomen?
No.
Okay, patient reports no nausea, vomiting, and no pain. Upon inspection, there are just no abnormal contouring waves, no signs of ascites, edema, or swelling. Peristalsis seems to be intact, and there is no pain reported. So I'm just going to listen to all 4 quadrants of your bowel as well as your vascular sounds for a full minute. Okay, so upon auscultation of the bowel sounds, they are present in all 4 quadrants, no hypo or hyperreactive sounds. The left and right iliac, the left and right renal, and the left and right femoral artery shows no signs of bruit or whooshing. No abnormal sounds were detected. I'm just going to palpate your abdomen now. Anything with that?
No.
Okay, patient reports no pain upon palpation. No masses, lesions, or nodules felt. No abnormal sounds heard. Okay. You can put your shirt down now. And I'm going to move to the range of motion in your legs. So I'm going to have you extend your leg. Could you pull up on my hand, please? Thank you. I'm just going to do range of motion. So I'm going to do flex, extend, abduct, adduct, and circumduct. Thank you. And the other leg. You can push up on my hand. Thank you. So I'm going to do flex, extend, abduct, adduct, and circumduct. Thank you. Was there any pain in your joints at all?
No.
Okay, so no pain was reported by the patient in the hips or the joints of the lower extremities. Strength is 5 out of 5 in the lower extremities and has a full range of motion in the hips. Okay, skin color on the legs, the abdomen, and the feet are pink, warm, and dry, and warm to the touch. Skin is adequately distributed and proportionate to the body. I'm just going to put gloves on to assess the feet. Okay, so looking at the toenails, they're smooth and non-tender. Capillary refill is less than 3 seconds. Looking at the pedal pulses, the dorsalis pedis pulses, and the posterior tibialis pulses. So both pulses on the feet are adequate in 2+, strong bilaterally. Assessing for skin turgor, there is a brisk recoil, no signs of tenting. I'm just going to take your foot, could you push up on my foot and up, thank you, and circle your ankle and spread your toenails out, thank you, and the other foot, same thing, down, up, circle your ankle and spread your toes, thank you. So the patient has a full range of motion in her feet and her ankles, is able to spread her toes wide, and has a 5 out of 5 strength bilaterally. Okay, so thank you so much for coming in today, and I hope you have a good day.